This medication is used to prevent or treat low blood calcium levels in people who don't get enough from their diets. It can also treat conditions caused by low calcium levels, like bone loss, weak bones, decreased parathyroid gland activity, and certain muscle diseases. It's important for normal nerve, cell, muscle, and bone function. Vitamin D helps your body absorb calcium and phosphorus, which is important for building and keeping strong bones. This medication is especially important for pregnant or nursing women, postmenopausal women, and people taking certain medications like phenytoin, phenobarbital, or prednisone. The recommended daily dosage and the optimal timing are best determined by consulting with a healthcare professional. When taking Upcal D500 Mg-500 unit/5 gram oral powder packet, it's important to take it with food to ensure proper absorption. If your daily dose is more than 600 mg, be sure to divide the dose and take it throughout the day for the best absorption. If you have any questions, consult your doctor or pharmacist for guidance. If you are using the liquid form of this medication, be sure to measure the dose carefully using a special measuring device/spoon. Avoid using a household spoon, as it may not provide the correct dose. If you are taking the chewable form, make sure to chew thoroughly before swallowing. For capsules, swallow them whole and do not crush or chew extended-release tablets to avoid potential side effects. Taking Upcal D500 Mg-500 unit/5 gram oral powder packet regularly at the same time each day will ensure you get the most benefits from it. If your doctor has recommended a special diet, it's essential to follow it to prevent serious side effects and maximize the benefits of the medication. It's important not to take any other supplements or vitamins unless directed by your doctor. Different forms of calcium supplements contain varying amounts of calcium and vitamin D, so it's best to consult your doctor or pharmacist to select the most suitable product for you. If you suspect a serious medical problem, seek medical attention immediately. If you experience constipation or stomach upset while taking Upcal D500 Mg-500 unit/5 gram oral powder packet, it is important to inform your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. However, it is important to seek medical attention if you experience any of the following serious side effects: nausea/vomiting, loss of appetite, unusual weight loss, changes in mental/mood, signs of kidney problems, bone/muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. While it is rare, a very serious allergic reaction to this drug may occur. Seek immediate medical help if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Upcal D500 Mg-500 unit/5 gram oral powder packet, it's important to discuss with your doctor or pharmacist if you have any allergies to vitamin D products or any other inactive ingredients. It's also important to share your medical history with your doctor or pharmacist, especially if you have high calcium or vitamin D levels, difficulty absorbing nutrition from food, heart or blood vessel disease, kidney disease, certain immune system disorders, liver disease, certain bowel diseases, low levels of stomach acid or bile, or any conditions that require you to limit or avoid sugar or aspartame in your diet. For pregnant women, it's important to talk to your doctor before using this medication, as doses of vitamin D greater than the recommended dietary allowance should only be used when clearly needed. Additionally, if you are breastfeeding, it's important to consult your doctor before using this medication. As always, it's best to discuss the risks and benefits of taking Upcal D500 Mg-500 unit/5 gram oral powder packet with your healthcare provider to ensure it is safe and appropriate for your specific situation. It's important to be aware of potential drug interactions that could affect how your medications work and increase your risk for serious side effects. Some products that may interact with Upcal D500 mg, 500 unit/5 gram oral powder packet include digoxin and phosphate binders. Calcium can also decrease the absorption of other drugs such as tetracycline antibiotics, bisphosphonates, estromostine, levothyroxine, and quinolone antibiotics. Additionally, certain medications can decrease the absorption of vitamin D. It's important to separate your doses of these medications as far as possible from your doses of calcium/vitamin D. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Also, check the labels on all your prescription and non-prescription/herbal products to see if they contain calcium, phosphate, or vitamin D, and ask your pharmacist about using those products safely. It's important to note that vitamin D is very similar to calcitriol, so do not use medications containing calcitriol while using vitamin D. Lastly, this product may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you use this product. If someone has taken too much Upcal D500 mg, 500 unit/5 gram oral powder packet and is experiencing serious symptoms like passing out or having difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of overdose may include nausea/vomiting, loss of appetite, mental/mood changes, headache, drowsiness, weakness, and tiredness. It's crucial to seek help right away if you or someone you know is experiencing these symptoms after taking Upcal D. Remember to have regular medical tests to monitor your calcium levels while taking Upcal D500 mg, 500 unit/5 gram oral powder packet. It's important to keep all medical and lab appointments and consult your doctor for more details. You can also increase your intake of vitamin D by consuming fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Additionally, your body naturally produces vitamin D when exposed to sunlight. To increase your calcium intake, try consuming dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables like broccoli, spinach, and bok choy. You can also opt for calcium-fortified foods such as orange juice. To reduce the risk of bone disease, it's recommended to stay physically active, avoid smoking, and limit the use of alcohol and caffeine. As for the optimal timing for taking Upcal D500 mg, 500 unit/5 gram oral powder packet, consult with your doctor for the best schedule that suits your needs. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When storing Upcal D500 mg, 500 unit/5 gram oral powder packet, make sure to keep it at room temperature, away from light and moisture. It's important to avoid storing it in the bathroom and to keep it out of reach of children and pets. When it comes to getting rid of this product, it's essential to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.